You don't need to go with that. That's okay. Like we go the way you can help you to remember the past medical history here. Yes, past medical history. So, like I talk about that. You can start with the mnemonic. Yes, PAMXITSFOSS. Actually, you can find a lot in many kind of resources in the internet. You can find lots of ways the student can suggest for you to remember those of things. Don't worry about that. I just collect the good thing. I think that's can helpful for you guys. So that's the past medical history. We know about that. Allergies, yes. Medication, hospitalization in the past. That's kind of sometimes important, let me give you example. Have some patient, we call kind of disease, we call in general English, we call this a fake disease. It means we call malingering or hysteria. You know about that disease, right? And in their past medical history, they hospitalization maybe a lot, many times in a month or even years. And they come and they start with a lot of complaints. But when they do the lab test, they do a lot of things. They cannot find anything. The doctor cannot find anything, and they discharge them. But after that, they hospitalize again. And about, we call this a malingering or hysteria. In Vietnamese we call it giả bệnh. So can help you. Okay, this guy or this woman today they come again. Okay, sometimes maybe that's from her problem, or they have a lot of the many time hospitalization before. That can help you to make the diagnosis for that. Do you contact actually contact like now we have a lot of ill contact with the COVID-19. If you in your family have any family member your parents or your children kind of like that, they have the disease. You are well, but after that you get the disease from them because the ill contacts. Trauma, surgery, family history. Alright, so for the family history, we will explain about a little bit after that. Up-guide procedures for the women. Yes, usually or mostly sexual history. Actually, the up-guide, you can start with the male in some disease, gynecology. They have disease for the male. Because the sexual transmitted disease or some specific disease to belong to the gynecology. Social history, all right. We will go detail after that. Sorry, here. But for the family history, yes, you need to take the first and second degrees of blood relative, and you need to reach back at least 2 generations. That's very important. You cannot take the history really far, because that's will not helpful to you. Don't have the meaning for that. But some people related to you, like your parents, first or second, right? First generation, second generation, maybe your grandparents, kind of like that. Or and the goal that they detect hereditary pattern for some generic disease. Okay, or identify contagious disease, or analyze the risk of providing preventive measurement. So it depends the purpose, but that's can help you to take the family history. So you need to go with the age, the health status of first degree with the major medical condition, first degree blood relative, a onset. Don't need to go with that. Progression, genetic defect, or some living status, first degree blood relatives. First of all, need to blood relatives. The second thing, this is really near your generation, and some start with the age. Let me give you example. Have some disease like Huntington disease. For the Huntington disease, that we call this the autosomal dominant inherited. It means like only one allele they can make the disease. You know about the autosomal dominant. So in the family they have the Huntington disease. That usually like if your father have that disease, and when it comes to you, your father can start with that disease at their age, is maybe 20 or 15, kind of like that. But come to your age, that if you want to go with the prediction, so you can get Huntington disease later than him. So that's the reason why, because we call like that's the belong to like we call like anticipation type of inherited. So the later generation can start the disease later than the first generation, but more severe. That's the meaning of inherited pattern. So the age of onset, that's really important for kind of disease. The living status, okay, you can go with that. That depends on you. Hysteria. Yeah, thank you. Alright, so actually that's a lot of, but I will try to go very quickly about that. Family, actually not so family history, I want to fix that. That's social history. Yeah, it's a little bit mistake here. That's social history. So the social history, you need to understand about their major, their social economic status, their drugs use. And because like you need to know the patient as a person, it means you know like because only the symptoms, only the medical history, only the past medical history, maybe it's not enough to like draw the picture of the patient. Sometimes you need to know as a person because they have common thing in their life, some the habit, some something related to their disease or their symptom. Like some patient they go with kind of very stressful work, and originally they have made trouble in their work, and their boss or just complain a lot of things, yelling a lot of things to him, and he feel like depressed with that, and that can exacerbate the disease, or mean the symptom of maybe anxiety, maybe depression. You know, so that's the reason why you need to start with the occupation or another things. And you need to, sometimes you need to support information to support them. So how can you give me example for that? Who can help me to give example? If you know about the patient, how can you support them? I mean about the social history. How can we support them?
I mean like you have to know about the patient, like you have to talk with the patient, and then you have to sympathize with the patient. Is that what you mean?
Mm-hmm.
Like if like they have any illnesses or like any like social disease that for example, like for an HIV positive patient, you mean like that? Like you have to understand, and you have to talk them with the tone that you understand. Like
very good idea. Yes, when you know well about the patient, social history of patient, sometimes you can sympathize to them, and sometimes you can support them. I'm not talking about support about financial support. I'm talking about spirit support. Listen to them well. And Mr. Ang example very suitable of this case. Or sometimes like have some elderly patient, or some people they live alone, and when they discharge from the hospital after like the surgery, and you don't know who can help them, because like sometimes they just live alone, and you don't know who can help them to call an emergency department, or call like I'm sorry, in Vietnam making 115, right? Yes, for saving their life, because sometimes they can phone or they can get complication of the surgery. So you can know well about that, and actually you can contact to the social service, or some people can support, even their family in their living far away can help them to stay with them a couple of days or weeks to support them. That's the way we can help the patient. And as I know from like the way we go with the good medical history, when you listen or everything, and if you start with the question like in there, if you discharge the patient and you ask the patient like who can help or who can support you when you go back home, or how any person can help you with that. So if you can understand well about the situation like that, it means like you care a lot to the patient. It means they can think like you are the good doctor, because you not only care about the symptom, you not only care about the disease, but you care about the overview, the something like that's really meaningful to the patient. I'm not talking about like just the emotion, but I'm talking about like that can support the patient about the medical field, but in another way. And you can make like promote healthy behaviors and lifestyle that can go with some like bad habit like smoking, drinking, or some like eating habit, kind of like that. And something you can collect from that like personal data or safety or sexual history or occupation, social history, medication, and alcohol use. Okay. Yes. And the last thing we can start with like a review system, like RS. And as I told you guys, after you have all this, you can start with a list of questions and arrange organ system, arrange like the review system by organ system, and you can establish the cause, sign, and symptoms. And you can establish the correlation and symptom or to the organs or the system. As I told you before, identify the potential or disease concern the patient did not report in the HBI or PMH did not report. Sometimes you can know from now. And establish the positive or negative organ specific finding. Alright, and the third is like it depends. We call this like comprehensive. Mean like comprehensive. It means like this overall and focus. It means you go cover only specific type organ, and actually like that's really connected to the chief concern or chief complaint. It means like the main thing you need to go. And for overview, you can go cover on the organ system. Alright, so that's can be both way. Are you tired? Actually, our lesson can stop here, and we and I know like that's a lot to you guys in 1 hour continuously, and you have to consume a lot of information. But I believe that's a kind of very familiar to you guys about something in Vietnamese style when you take medical history in the hospital as a medical student or even as a doctor. I just like paraphrase into, or I convert into English and can help you guys how in the medical history. I'm talking about in English, medical history in English. How can they call by the like that? How can they present those of things in one day record or medical record? And I will send. I also bring kind of like a list of questions for you guys to practice to collect the medical history in here. So let's start with like some kind of question how you can practice at home, because I will not deliver it today. Just like very simple, like just opening the encounters. Mean like how can you start the conversation? Like you can start with the hello. You can call their name. Hello, I'm doctor, and it's nice to meet you. Just want to inform them about like who you are, and confirm them name and ask them about like the reason or some like thing, some question related to the reason they come to your clinic or your hospital. I like to ask your question or exam you today. It depends. How can I help you today? That's another way. What brought you to the hospital clinic today? What made you come in today? So we can have many ways to talk to the patient or start the conversation with that. You can start with kind of like review system. That's the list of that. You can take a look at this. If you have any question, just send us in the the group, the post in the group, and we will happy to explain to you guys about that. Some kind of like abbreviation way they bring here, or some kind of like the reason they give a lot of information here, just about for the system by system. So don't worry about that. Just take a look at this, and you can know how can you get through all the system together like that. And more specific, they will have the checklist. To be honest, in the medical record, they will have a checklist. You just like tick 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 tick, you know. So yeah, if the patient has that symptom, tick that, that. So just try to ask them about this. Or even like family history, you also have some kind of question here. We call the sample question. You can start with anyone in your family similar problem, or parents alive or good health. What did your mother or father die of, because you care about the inherited disease or some like correlated disease, or they still stay alive, kind of like that. Social history, yes, smoking. If you go smoke, you go with the bags per day, and how long, or do you drink alcohol, what, and you need to ask about the amount of this. Or some like recreational drugs, or marijuana, cocaine, some like illicit drugs, and ask them about this. Confirm. Nowadays the youth, they use a lot, not only in a developed country, in our country too. Alcohol, more specific with the alcohol history, sometimes you need to ask more about that, and like how much, as I told you, and we have like the cake questionnaire. Like you can go with like do you need to cut down, mean like your expectation. Annoyed, mean your feeling, mean I'm not talking to the person who drink alcohol. The guilty feeling, yeah. And the eye opener is mean like in the after, have you had a drink first thing in the morning to steady your nerve, or get rid of hangover. It means like you want to quick from the symptom of the hangover after the night you're drinking. It means like I will talk about this. Yes, so you can need to take all the information from that. And the sexual history, the same. We also have cutoffs. Need to understand about the sexual active, the situation of patient, or even like any STD, sexually transmitted disease, or some like contraception. That's also very important for the both the women and for the male. How we can go with the erection. Erection is being related to something. Yeah. So for a couple of questions, you can take a look at it at home and practice, please, with the good grammar and the good way to ask. For the good ways, mean like go to direct, specific, and the thing you want to collect, simple, yeah, simple, specific, and correctly. This means you start with the question like that, because the patient, they are very general knowledge and very general English, so you don't need to go very like high education. They cannot understand that. Start with the common words. Avoid medical jargons, please. Medical jargons mean like medical terms. Don't go with like a myocardial infarction. No, they don't know that, but they know well what the meaning of a chest pain or even stroke. Yes, but don't go with the myocardial infarction or a kind of angina. They will not know about that. All right, so let's try to practice at home about kind of some symptoms, or even like the question like that, and try to answer by your own if you want to practice more. You guys have any question for me? We have one question here. Dr. Long asked like any document like textbook, a website about sample question in order to collect medical tracking. Yes, we have. I can recommend you go with like US MOE CS, Step 2 CS. They have like a very big book, and they have a list of questions you can start with and practice based on the case, or even like based on the symptom. You can collect the symptom from that. And they also have some, like we call this short mini case and some practice case for you to try to practice by yourself. And yeah, and please, like if you want to improve your speaking, you need to find a supervisor, you need to find a friend who can, we call this the person who practice with you together. That's really boring if you go by your own like that. Sometimes you feel this can stop you to improve that. All right, so any question for me now?
Well, what about an app? I would recommend you an app. It is called Ada. Yeah, Ada.
You can just send to him. Very good.
It is just like an app. This is an AI that can tell you. You just try your problem, the symptoms today, and AI would ask you some more questions about it, and you can learn from AI. Actually, they collect a lot of information about the medical information from the world. So I think it's an app is actually a kind of a book. You can get some information about how to take medical history from them. It's like Ada or Ada. Yeah.
Ada.
Right now.
This is on iOS or like Android?
Well, I just use it in Android, but I don't know if it is acceptable or it is suitable for iOS.
Yeah, they also have the version on iOS. Don't worry about that.
Okay.
Thank you so much, Dr. Thuong. Yeah, you can use both of them. Good, very good recommendation. All right. So any thing you want to ask or anything you want to explain more?